This is Dr. Al-Hamamsi, one of the teaching faculty in the internal medicine residency program of Memorial Hospital. I'm recording this video to explain to the incoming intern batch how to call a consult and how to call a physician. So how to call a physician, even if the physician is your senior resident, you're attending and you want to discuss a case, or if you want to call a consultant, a subspecialist for your patient. So first thing, before calling the consultant and before calling a physician, you need to know your patient well. Even if you're cross-covering, even if you're just covering a patient from a different team, you can't call a physician and tell him, I want to discuss this patient with you, and then say, well, he's not really my patient, he's this resident's patient, I don't know him, but I'm just asked to call you. So you have to really know your patient well. You have to go, you have to examine the patient, you have to look at the chart, have the chart with you, or access the electronic medical record before calling the consultant or the physician. When you call the consultant, you have to have the patient's name, the patient's date of birth, and room number. You can't call the consultant and tell him I'm consulting you on Mr. So-and-so, but you don't have the correct name. When he asks you where is the patient located, you don't know where the patient is located, you don't know the date of birth. You have to have a reason for the consult. So when you call a consultant, you're asking the subspecialist to come and see your patient to answer a particular question. For example, does this patient need surgery or no? So you have to have a specific question that you're asking the consultant. You can't just tell him, I'm calling a surgical consult because the attending told me to call the consult. You are responsible. You are the primary care provider of the patient. You have to know your patient, and you have to know why you're calling the consult. You can't just call and say, I don't know why I'm calling, but I was asked to call you. You have to know your patients. So the first thing, know your patient well, have all the information on your patient, go examine your patient, have the chart with you, have all the information with you before calling a consult or calling the physician in charge. Thank you.